Okay, so diet and mental health. And the question is, can diet affect mental health and well-being? So there's evidence of an association between a poor diet and exacerbation of depression and anxiety, and also other neuropsychiatric conditions like epilepsy, ADHD, autism. And then there's another question, can diet affect our cognition or help to prevent dementia? Now, looking at ADHD and autism, there are very few studies, small sample sizes, poor quality of those studies. And yet, just to share with you in terms of ADHD, a lot of things that have been looked at. Eliminating food additives was one of the early things, I think back in the 70s. Reduced sugar versus a diet that's high in fruits and vegetables. Supplementing with specific fatty acids or with certain vitamins and minerals. Those have all been looked at. As I said, studies are not definitive or conclusive by any means. And then in terms of autism, looking at the role of gluten potentially or casein intolerance, or again, would supplementing make any difference with various vitamins or minerals? I'm just going to say the jury is still out on these areas. And so I don't want to try to pull in any more information about these particular concerns. Instead, I want to focus on depression, anxiety, happiness and mental well-being, and also cognition. How much does diet play a role in each of these? So there is, you may be surprised to hear, an International Society for Nutritional Psychiatry Research. And they published in 2015 in the Lancet Psychiatry, diet is as important to psychiatry as it is to cardiology, endocrinology, and gastroenterology. But what's the evidence? And again, even in all these other areas, there are few high quality studies up to this point. But I do want to share with you what we've found. And some are high quality. We have seen, and you can see I've cited a number of studies here, that there's an observation that people who consume more fruits and vegetables tend to be happier and have higher levels of mental well-being. Now, of course, in all these studies, they've done their best to control for variables. And yet, we still don't really know, could there be some reverse causality here? In other words, people who, maybe it's not just that consuming more fruits and vegetables makes you a happier person, but because you're a happier person, are you consuming more fruits and vegetables? So it's difficult to make that association or to make a definitive declaration about that. I want to just look in the chat. So sounds like some people are having problems with sound, and I hope that's only very few of you. It may be unstable Wi-Fi on your end. I'm hearing from the other people that the sound seems to be fine. So in this study, plant-based diet was looked at, and they wanted to see, is there any association between that and mental health and well-being? You can see university undergrads were used, and they identified 3 dominant dietary patterns: plant-based diets, animal-based diets, or interestingly, they did find a pattern that seemed to be junk food diet. And they found, or they also measured levels of anxiety and depression, as well as quality of life. And the only positive association that they observed was between those who were following a junk food diet. They seemed to have more depression. So there was another study, 12-week dietary intervention looking at depression, called the SMILES trial. And this is a very long and involved acronym. If anybody's interested, I can send you what it actually stands for, but it's always referred to in the literature, as far as I can see, as the SMILES trial. And they had people either meet with a registered dietitian, you can see 31 of the people did, or the control group was they met in a social support group over these 12 weeks. And they matched the amount of time in the support group to the amount of time that people had with a registered dietitian. This was a single-blind randomized control trial. And so they got 7 points of contact, 7 sessions with a dietitian over those 12 weeks. So matched in the controls. The dietary group showed significantly greater improvement in their depression by 12 weeks. And what I thought was especially interesting was 32.3% actually achieved what was considered to be remission of their depression in that group that met with the dietitian versus only 8% in the control group. So what were the key foods that were encouraged in that trial? And I want to show you in terms of what the foods were and how many servings per day everybody was aiming for. So 5 to 8 servings per day of whole grains, vegetables and fruit, 6 servings a day of vegetables, 3 servings a day of fruit. That is far and away more than the average American consumes in a day. Beans, 3 to 4 times per week. And then low-fat, unsweetened dairy foods, 2 to 3 times per day. So this would be milk, yogurt, would also include cheese. Raw and unsalted nuts once a day. And then fish and lean meat at least twice a week for fish, and then lean red meat 3 or 4 times a week. Chicken and eggs 2 to 3 times a week for chicken. No more than, they specified, 6 times a week for eggs, and then 3 tablespoons of olive oil per day. So that's what they considered to be a healthy diet, and people were encouraged to eat in that way, and their depression seemed to respond to that. They also recommended to limit in that trial sweets and sugary drinks, refined cereals, those that were really pretty stripped of fiber, and then also fried food and fast foods and processed meats. So those recommendations seem to result in better mental health. Now, there was a systematic review of 20 longitudinal and 21 cross-sectional studies, so pretty big review. And these various studies looked at how much people adhered to a variety of types of diets. The Mediterranean diet we've all heard of, I'll go over what that entails. And then the DASH diet, or dietary approaches to stop hypertension, we'll also review what that is. The healthy eating index and the alternative healthy eating index are measures of what is considered to be healthy eating. They're very similar to Mediterranean and DASH diets. And then there's also an index for dietary inflammation. In other words, certain foods that are associated with promoting inflammation versus tamping down inflammation. So what were the results of that? Let's first of all look at Mediterranean diet. And just in a nutshell here, I'm trying to describe what that entails. Mostly whole grains. There are nuts and seeds that are recommended on a consistent basis. Fruits, vegetables daily. Beans, herbs and spices are encouraged with the Mediterranean diet. Olive oil is the main fat. And then fish, seafood, low-fat dairy typically, but also poultry used moderately. And then red meat and sweets are recommended to be limited, used only occasionally. And then the DASH diet is very similar, very high in vegetables and fruits. And then there's a big emphasis on fat-free and low-fat dairy foods. Also fish, poultry, beans, nuts, as you can see on your screen, vegetable oils, limited foods that are high in saturated fat like red meats, full fat dairy foods, and then the tropical oils like palm and coconut oils that are a big part of a lot of processed foods, and then limited sugar sweetened drinks and sweets in general. So you can see there's a lot of overlap between Mediterranean and DASH diets. So these studies that I was just referring to, that were reviewed, showed a protection against depression was associated with adhering to a healthy diet, especially the Mediterranean diet, and also the avoiding a pro-inflammatory diet was associated with less depression. So I want to put back up on the screen what is the description, a very brief description of the Mediterranean diet. And here, instead of the DASH diet as comparison, you can see what's an anti-inflammation diet. So again, you're going to see abundance of vegetables and fruit, also nuts, moderate intake of wine, and then low intake of those pro-inflammatory foods like processed meats and trans fats. A lot of people might be aware that technically since 2018, trans fats have been banned in the American food industry up to a point. If a food has less than a half gram of trans fat per serving, it can still be used as an ingredient in that food, or it can be listed and will be listed as zero trans fat on a nutrition facts panel. So, but basically, there's a big difference today in how much trans fat is in the American food system versus before 2018. So, when we look at 16 randomized controlled trials, they explore the effects of diet changes on depression and anxiety. And you can see it's a pretty good size number of individuals included, mean age of 55, but a very wide range. So there were different interventions or objectives of these interventions. They were all trying to change the diet, but in the service of improving nutritional intake, decreasing fat, or reducing body weight. So again, let's keep this in mind. They had different objectives of each of these groups of studies that were done. But all of the interventions did have some common objectives, and that was what you see here, in reducing junk food intake, so having less of the high-fat, high-sugar foods, fewer takeout foods, and also to increase the high-fiber, nutrient-dense foods like vegetables that we see recommended all the time. Results of this meta-analysis, all dietary interventions significantly reduced depression. And there didn't seem to be any effect on anxiety unless you looked at the studies that had mostly females. And this was only 8 studies, but they showed greater benefits from dietary interventions for depression, like the other studies, and also anxiety. So this raised the question for me, is mood in women more affected by diet? And then the question too, are women's food choices more affected by mood? I mean, it can go both ways, right? So this question came up for me several years ago. This is when I actually first started becoming interested in this. Are women different in terms of mood and our interaction with food? Do we do a more emotional eating, for example? I was at a meeting, and you can see this was a long time ago. I'm not sure the exact date. So let's say around 1999. This was a meeting at Family Medicine. And we were waiting for everybody to arrive. So my sample size is about 4, 2 women and 2 men. And I had just met with a patient, and we had this discussion about the patient's comfort foods, which the patient found challenging to resist at times. And I threw out the question to the group, what are your comfort foods? All right, the women answered with a whole list of comfort foods: cheese toast, mashed potatoes, chocolate is going to figure prominently for many people as a comfort food, ice cream, peanut butter. The men responded, remember, there are 2. What's a comfort food? So this struck me as, wow, I wonder if there's something to this. But as I said, this is an N of 4. This is an anecdote, not a study. Yet, it is interesting. There was a 2015 report on overeating in college students, and they found in that study that females were more likely than males to report that depression, anxiety, and stress influenced their overeating. And then there was a Taiwanese adolescence study. You can see more than 18,000 participants. Almost half of them were male. And emotional eating was associated with eating more fast food and high-fat snacks, processed meat products, more dessert foods, and sweet drinks. Compared to females, males consumed more fast foods, high-fat snacks, and processed meats as well as those sugar-sweetened beverages more often, but they consumed dessert foods less often than the females in general. There was a French study looking at emotional eating in men and women. We have a lot more women in this study. And among the women who are depressed, emotional eating was associated with higher consumption of energy-dense snacks, read sugar and fat. And let's really examine this. If you're hungry, physically hungry, you are not usually reaching for the sugar. When we are emotionally hungry or eating out of emotion, sugar tends to figure prominently. So this was found among the women to take place when they were feeling depressed. And interestingly, in the men, that relation between emotional eating and energy-dense snack foods was only found when they were not feeling depressed. So this was a little different from expectations of most of us, I think, and different from previous studies. So obviously how we respond to emotions is very different. And when the Tar Heels win, I want to eat was a quote by one of my patients a number of years ago. And I will quote what he also said, when the Tar Heels lose, I want to eat. So we all do respond differently, and it's hard to put people into categories with this, gender-wise or otherwise. But clearly, for many people, there is a cycle of mood affecting food choices, and then those food choices affecting mood. So it is a vicious cycle that circles back and promotes itself for many people. This was an interesting study that was done in Norway, and in Norway, the government keeps some very extensive data on people from the time they're born. And so it's for a lot of people who want to do health and social kind of studies, there's a gold mine of data there. So they wanted to know, can diet early on in life predict personality traits as well as actual mental health by age 8? So there were almost, more than 40,000 participants, and they collected diet on mom's diet before the baby was born. Then they also collected dietary information on the infants at ages 6 and 18 months, and again when they were 3 years and 7 years old. They also then, at age 8, for each of these enrolled in the study, assessed their mental health and personality trait. So a lot of you might have heard of what's termed the Big 5 personality traits, used in research a lot. Extroversion, benevolence, conscientiousness, neuroticism, and imagination. So they measured these. I'm not a psychologist, so I don't know how these are measured, and it's specified in the study, but I don't have that off the top of my head. They also looked at symptoms of depression and anxiety at the age of 8 years old. And they found positive associations between diet scores and extroversion, benevolence, conscientiousness, and imagination, what we would all consider to be positive elements of personality. They found an inverse association between healthier diets and depression and anxiety, as well as neuroticism. So what's neuroticism? Let's remind ourselves: trait disposition to experience negative effects, including anger, anxiety, self-consciousness, irritability, emotional instability, and depression. And with neuroticism, people respond poorly to environmental stressors. They can often interpret ordinary situations as threatening, or minor frustrations can be, as you see here, hopelessly overwhelming. So in other words, neuroticism is not the resilience we'd like to experience ourselves or see in our children. That's not an association between, let's say, if we reverse that, poor diet and higher neuroticism that we want to see. So we know from conception to age 2, that's a very crucial growth and developmental phase for all parts of the body, but including for the brain. So adequate nutrition is essential for that normal development. These are just some examples: long chain fatty acids, iodine, iron, and then also eating events that take place early in life really helped to indoctrinate us to what are the normal cultural values, and they're very important for socio-emotional development. So that sitting around the dinner table is an important part of child development, I would argue, and that goes way beyond any nutritional aspects of the meals that are served. So then there's another consideration here, and that is we have often, and many of you have read, the gut referred to as our second brain. There is a neural superhighway that goes between our gut microbes and our brain, and there is constant communication there. Trillions of these gut microbes influence our brain function and also influence our mood and even our behavior. This is the whole area of research that looks at how our gut microbes actually influence behavior is fascinating. Much of that behavior is influenced through our mood. If we are feeling a certain way, we're more likely to practice certain behaviors. So hormones, neurotransmitters, immunological factors from the gut send signals to the brain. We know that. And then diet is thought to explain roughly 20% of the variation in human gut microbiota. So we are born with a certain type of microbe profile, you might say, in the gut. It does develop, especially in the first, say, 3 years of life, and it is changeable, but there's still a whole lot we don't understand about this. And one of that is, what is the impact of diet on how much those gut microbes change, and therefore how much they can affect mood and behavior. Now, we do know that what's called the Western or American diet negatively affects a lot of our gut microbes. And diets like we talked about before, the Mediterranean or the DASH diet, dietary approaches to stop hypertension, positively influence gut microbes. And so what has been stated in, you can see I've cited a couple of studies here, diet is a potential tool in the clinical management of different disease conditions and for prevention and also health promotion. So that would include mental health conditions and well-being. So when we look at the Mediterranean diet, it's a very busy slide here, but we can see that it's a good source of fiber through beans, whole grains, a lot of fruits and vegetables. And because of all of these foods, we're also getting an abundance of vitamins and minerals. And then also the Mediterranean diet, with its emphasis on extra virgin or even just regular olive oil, high intake of high quality fats, the monounsaturated fatty acids, that would be olive oil in particular. Omega-3 fats coming from fish in the Mediterranean diet, and also polyunsaturated fatty acids from nuts and seeds. So it is, when we compare it to a Western diet, it is lower in what are called the omega-6 fats, and it's higher in what we call the omega-3 fats. And we understand that to be desirable in terms of nutritional status. The Mediterranean diet, again, because it relies on a lot of plant foods, it is what we would call not necessarily a vegetarian, but a plant-based diet. It's loaded with not just polyphenols. These are one example of a class of phytochemicals that have antioxidant and anti-inflammatory properties. So all of this combined means that we have intestinal barrier integrity, avoiding what is often called leaky gut, And then it also is very, very good for our gut microbes. Especially the fiber that you find here and the low intake of sugar and highly processed foods tends to be very good for feeding our friendly bacteria. And I'm not going to go through all the details here of a Western diet, but it's kind of the inverse of that Mediterranean diet and can result in what's called gut dysbiosis, altered metabolites. In other words, when we have gut microbes that are being fed the way they want to eat, then we have, as a byproduct of their digestion, we have metabolites that are healthy for us and they promote health. And all of this translates into different effects of those gut microbes because of different profiles of gut microbes affecting our brain health and our mood, and as I said before, potentially our behavior. So probiotics, and this is a direct quote, have a potential role in the treatment and prevention of anxiety and depression. Now, can I tell you which probiotic formula to consume in terms of a supplement? No. And if anyone tells you they have the answer to that, I would look at that with a lot of suspicion. But we do know no probiotics, including those that are naturally fermented foods, are regulated by the FDA. So that's whether you're buying a supplement off the shelf at a drugstore or you're eating a lot of yogurt or sauerkraut for that matter. Factors such as gender, obesity, lifestyle, tobacco, and alcohol use may impact what kind of benefit or any effect of probiotics on the system. So I want to point out that this quote was made by the authors of this article, but in the same articles they say probiotics cannot be considered a reliable therapy for anxiety and depressive disorders until we have a lot more evidence about their therapeutic use. So, most of the studies I have seen, and I haven't looked for this extensively, but I would say generally we think you're probably fine to experiment with probiotic formulas and supplements, but don't expect to get off an antidepressant because you're using a probiotic, obviously. So then that question of can diet affect cognition or help prevent dementia is an interesting one. There's something called the MIND diet, which stands for Mediterranean / dash intervention for neurodegenerative delay. They looked at dietary patterns that could potentially reduce the risk of Alzheimer's disease. And so let's look further. This really was a combination of the Mediterranean diet and the DASH diet. So they collected data in this particular study on cognitive tests and dietary habits of 923 adults, middle age to older age, and they followed them for an average of 4.5 years. The MIND diet encourages consumption of 10 what are considered to be brain healthy food groups, and I'll come back to that and describe those in just a moment. But it also discourages food groups like red meats, butter, and stick margarine, foods that are high in saturated fat. That would include cheese, of course, and then also just in general sweets, desserts, sweet beverages, and processed foods. And when I say processed foods, of course, I mean ultra-processed or highly processed foods. Let's back up to that. How do we define highly processed foods? A simple definition, there is a technical definition of that, but a simple definition is if you can not replicate this food in your kitchen, probably it's a highly processed foods. For example, Cheez-Its, cornflakes, those are foods that we can't really make from the initial or the original ingredients. So in this study, those who adhered very strictly to the MIND diet had a 53% lower risk of Alzheimer's over the following 4.5 years. And here's what I consider to be very good news. Those who followed the diet only moderately had a 35% lower risk. So that's encouraging. These are the brain healthy foods that they identified. Green leafy vegetables, all other vegetables, nuts, berries, beans, as in not green beans here, but legumes, pintos, kidney beans, black eyed peas, lentils, whole grains, fish, poultry, olive oil, and wine. So these were considered to be the brain healthy foods, and people following a MIND diet were encouraged to eat more of these. So other studies of a link between diet and cognition. This was a study of 50 obese women, middle-aged. They had only 3 months follow-up, and they showed improved brain function and structure when they had images of the brain when they followed the MIND diet pretty closely. I do want to say that there was a study published just last year where they followed people much longer than 3 months, up to 15 years, and they saw what seemed to be a real benefit of the MIND diet early on in that follow-up, and then that was attenuated over time. So by the end of 15 years, there didn't seem to be much benefit. So again, we don't have all the answers. We don't know. But if we consider that there's a good chance following this healthier diet keeps us sharper for longer, there are probably a lot of us who would say, count me in. Many nutrients are essential for neurotransmitter production. And you don't really have to be a neuroscientist or a physician or know a lot about serotonin, dopamine, and norepinephrine to have heard of these and have heard of these in the context of depression and mental health. So if we're following a diet that's healthy, we're providing our body with the building blocks for a balance of those neurotransmitters. Also, vitamins B6, B12, folic acid, and then amino acids, phenylalanine, tyrosine, histidine, choline, tryptophan, glutamic acid, not common household words, but those are just different amino acids that make up protein. And all of these help to provide the building blocks of neurotransmitters that help us to regulate mood, also regulate appetite, as well as cognition. So it just makes, if nothing else, intuitive sense that if we provide the building blocks of these neurotransmitters, then it's going to be beneficial for each of these outcomes: better mood, appetite management, and better cognition. So also associated with mental well-being, I don't want to leave out a discussion of these other very important considerations. Physical activity has been shown time and again to improve mood. Avoiding alcohol, various street drugs, tobacco, what kind of environment we spend most of our time in makes a difference to our mental well-being, obviously. Sleep, there's so much that we know now that even 10 to 15 years ago was not in the literature, but optimal sleep is huge. Stress management and actually having some strategies for managing our stress, and then incorporating those social connections, social support, having fun, leisure time activities, and then mental health activities that are actually healthy. So let's take a look at each of these just very briefly. I should say most of these very briefly. Physical activity, one of the things I mentioned to my patients is not the importance of not just being physically active, but I believe, and there's evidence in this in the literature, of getting outside and doing some kind of activity in an outdoor environment is beneficial to mental health. And then safe and peaceful environment where we live, where we work. A lot of times this is very difficult to make changes. We don't have options there, but to the degree that we can control that, it can be very helpful. Optimal sleep, yes, that's a tough one to manage. And for some of my patients, they're coming in to see me for nutrition, and I'm pretty surprised at how much in the last few years I spend talking with patients about their sleep. Because for sure, if, for example, you're trying to get better control of your blood pressure, of your diabetes, any element of metabolic disease, including obesity, if you're not getting optimal sleep, it's going to be much more challenging for you to manage any of the rest of that. Optimal sleep is going to be crucial. And sleep deprivation, let's remind ourselves, is associated with neurotransmitters and hormones being driven in a direction that increase your appetite, increase your ability to store fat, and decrease your metabolic rate. And feel free to email me, jeannie.sykes@conehealth.com, if you want information or studies that back that up. It's well documented. I just want to make the emphasis here too that enjoyable activities or leisure time activities and sleep and rest are all three individually different components of self-care, and we need all three. So the degree to which we can accomplish those at a good level for our own selves, that's going to be contributing to our mental well-being. And then lastly, I just want to comment on healthy mental health activities. And just think about how you're using your smartphones, what social media you participate in, and what you feel like when you have completed, say, a few minutes, or maybe worse, an hour or two on social media. It is distressing to me to talk to some of my adolescent patients and find how much time we're talking hours per day on social media, and I am convinced this is a huge detriment to mental health and well-being. So those of us who are not adolescents anymore are just as vulnerable and can go down that rabbit hole of following, just continuing to scroll and reading, and you can feel it if you really pay attention to it. So be intentional about your use of your devices and your social media. All right, so I also, when we talk about all of these different factors, not just diet, we need to think about the interactions between them. And I'm going to give you just two examples here. When we look at sleep and diet, we know diet affects our mental health. We've just been talking about that. We know sleep and adequate sleep, quality sleep as well, and consistency of sleep in terms of our sleep schedule. These all affect mental health too. But we also know our diet affects our sleep, and our sleep affects diet. I've actually given one of these webinars on that very topic, and it's quite fascinating to see the interaction between sleep and diet. But then when you consider, and this is one of the things we talked about earlier, mental health affects our food choices. And then again, our food choices affect our mental health. And the same thing happens with sleep. If you're worried or stressed about something, that's impacting your ability to sleep. And then that sleep is again potentially worsening your mental health. So a lot of interactions. And these are just two of those factors of the several factors on the previous screen. So looking again at all of these factors, and in the area of cognition, there's the China and Aging study, and this was a prospective cohort study. They looked at the link between these various lifestyle factors and cognition. They had nearly 30,000 participants. Everyone had normal cognition at the beginning of the study. Mean age 72, and roughly half women, half men. And they followed them for 10 years. So it's a pretty meaningful study here. These were their 6 modifiable factors that they were exploring: physical activity, smoking, intake of alcohol, and then cognitive activity, They were looking at how often they would play mahjong, for example, which was also could be social as well as cognitively challenging. How often did they write or read or play cards or other games? And then they looked at their diet and specifically how much did they eat of fruits, vegetables, fish, meat, eggs, dairy products, and so on, you see on the screen. And then they also looked at social contact. How often did they attend meetings, parties? How often did they visit with others, travel, and even looked at online chats? So those were their modifiable factors. And they also looked at the APOE4 genotype, because what's known is if you have this genotype, then that is a risk factor for earlier cognitive decline. And they wanted to see if even those with this genotype could be influenced by those other modifiable lifestyle factors. So they stratified people by either you were this genotype or you were not. And memory declined faster as expected in those who carried that genotype versus the non-carriers. But both carriers and non-carriers with favorable or average lifestyles showed slower memory decline versus those with unfavorable lifestyles. So again, we see that if we can look at all of those factors, or at least many of those factors, and control them, that's going to be a more positive outcome in terms of cognition. So in summary, diet that we would recommend for optimal mental well-being: fruits, vegetables, lean protein sources, whole grains, beans, herbs and spices. And I want to emphasize here, when I say herbs and spices, actually I'm not meaning salt here, even though I guess we could consider that a type of, well, that's really a seasoning. It's not an herb. It's sodium chloride. So spices would be like turmeric or ginger, even onion and garlic. And we know that there are some meaningful influences of a high herb/spice intake on our, for one thing, gut microbes is one way in which they can influence our health, but also on inflammation and oxidation. So diets that are very high in some of these various components can be beneficial in that way. So also, if we were to summarize what we've learned from a look at this literature, ultra-processed foods we want to limit. We want to limit sweets and sugar in general. That would include our beverages. And fast food and fried foods. Fried foods are typically a source of saturated fats. The polyunsaturated and monounsaturated fats do not hold up so well to the high temperatures of deep fat frying. Therefore, they're not used as often. And so that's why fried foods tend to give us more of the saturated fats. Fast food in general tends to have more of that saturated fat, as well as being comprised of ultra-processed foods. The carbohydrates that you're consuming in ultra-processed foods are not equivalent to whole grains. For example, just plain old brown rice or quinoa that you can cook and then incorporate to recipes. Or barley. You can make, for example, a barley vegetable bean soup that has lots and lots of nutrients in it and phytochemicals, going to be good for you all the way around. And then processed meats. Processed meats come up time and again when we look at recommendations of what to limit in our diet. We know that higher intake of processed meats has been associated, and I am going to say here, observationally, we don't have an intervention study that proves cause and effect, but we see higher rates of some kinds of cancer with high intake of processed meats, and then they have shown up in these studies that I've been looking at for diet and mental health as well. And also choosing extra virgin olive oil. It's been used for centuries and to good outcomes. And then having moderate intake of wine and unsalted nuts. I say unsalted because obviously here in this country we get probably way too much sodium to begin with. So if we can use unsalted nuts, that's going to be better for us in the long run. And then I also say moderate use of nuts for two main other reasons. Most nuts are going to be a high source of polyunsaturated fats, some monounsaturated fats as well, which are safer to increase in the diet, I would say. Polyunsaturated fats in excessive amounts have been associated with increased risk of certain types of cancer, and they can put us at greater risk of pro-oxidation in the body and so on. So, and this gets into some technical stuff, but let's just say very high intake of polyunsaturated fats is probably not desirable. And then another simple fact about nuts is they're very, very high in fat, even though it's a high quality fat. That means they're loaded with calories. And if you're trying to manage your weight or balance your intake with your energy expenditure, nuts in moderation is a good idea. Excessive amount of nuts makes it harder to manage your weight. So a DASH eating plan, if you were to consume 2,000 calories a day, which is probably a fairly good average intake for most Americans, your intake is going to look something like this. And as we saw from previous slides, the DASH diet is very, very similar to a Mediterranean diet, and it coincides very well with some of these other recommendations that have been found for promoting plant foods, for example, limiting some of the types of fats and sweets that we've talked about and so on. So this is, again, I'm not going to read off each of these, but you can see how that looks and kind of think about how does this compare to what your diet looks like. One of the big differences in the DASH diet versus the average American diet I will point to here is vegetable and fruit intake. So we're looking at 8 to 10 servings a day of fruits and vegetables. That is very, very different from the average American intake. And so I also want to point out that a serving is just a half cup of cooked vegetables. Or if it's a salad, raw vegetables, we're going to consider that to be 1 cup. But still, it may not be quite as daunting as it appears if you consider a half cup. So 2 cups of cooked vegetables, you're already at 4 servings for that. So you meet your vegetable recommendation for the day. So with that, I am ending before our hour is up, but I would love to open it up for questions. And I invite you to use the chat if you want to type in a question or a comment for that matter. Or also feel free to unmute and ask your question verbally. Any questions? Okay, guys, you know, I'm here sitting at my computer, and when I don't get any response, I'm concerned nobody can hear me. So I did hear early on that the audio was coming through. Any thoughts, questions, comments? Well, thank you. Will I provide my slides is the next question. And I will check with employee wellness because that employee wellness is behind putting on these listen and learn sessions. And I think if you have signed up for today's talk, which obviously you did or you wouldn't be here, I think everyone will get a follow-up email with a recording. So that in that sense, you will get the slides. I don't know about sending, for example, a PDF of the slides, but you should get access to a recording, and I'll ask that Employee Wellness sends out a correction to that if I'm wrong, but we'll do our best to get that to you. So any other questions? I'm looking through the chat. What's your opinion about Weight Watchers diet? Yeah, and I'm glad you asked that question because Weight Watchers for many people has been helpful in managing basically how much you're eating versus how much you're expending. It doesn't count calories, and anybody who's not lived under a rock for the last few years knows that Weight Watchers uses a point system that takes into account nutritional quality of the foods, let's just say, as well as really there is an element of counting calories that's built into the point system. So it's, in my opinion, better than counting calories, which I don't recommend for anybody. It's better than counting calories because if you consume a targeted number of calories, you can do that in eating all ice cream, for example. There's nothing that ensures that you're going to eat in a good way or a nutritious way. So the point system is better than that. It is a step up from that. However, you can still consume the recommended number of points in what Weight Watchers gives you for your target for the day and not consume a nutritious diet. So I think a really great way, if you find Weight Watchers to be appealing and you find that it is helpful to you, a great way to follow that program is to also then get an appointment, 1, 2, 3 appointments maybe with a registered dietitian, and learn some of the more details around good nutrition that will help you really achieve that optimal diet. And then you can use that together with the Weight Watchers point system. I do want to mention, of course, if you are an employee at Cone, you have, and if you are insured by Cone for your health insurance, you have access, probably, there may be some varieties in insurance policies that I'm not aware of for 2023, but you probably have access to a registered dietitian for no cost to you. And also, you're probably aware of that, Kate, I'm going to ask you to remind me, Healthy Bucks program. I forget the actual title of it. But if you see a dietitian, I think it's 3 times in the year, that would qualify you for some reimbursement or some of the lifestyle bucks, maybe they're called. Anyway, Kate, if you're listening and you can correct me on that, that would be great. So opinion about the Weight Watchers diet, well-being bucks. Okay, Kate has chimed in on the chat, well-being bucks. So that's something you may want to pursue if you are a Cone Health employee, or even if you're not, it may be beneficial to you. And we have lots of dietitians at Cone Health, including myself, who'd be happy to work with you on your diet. So I don't see any other questions in the chat. I'm not hearing any on audio. So with that, I will end today's session and we'll quit recording. Thanks for participating, and I hope it's been useful for you.